Fantastic. So, without further ado, I'd like to introduce our speakers for today, Tyler Stump, Indy Nearhart, Dr. Robert C. Allen, and Dr. Gary Gala. Take it away.
All right, thanks, Elizabeth. And now for the obligatory pause while I share my screen. All right, hopefully everyone can see this well enough. If not, just unmute and let me know. Hello, everyone. My name is Tyler Stump, and since I'm going to be the first presenter from our group, we just figured that I would do the kind of the general introduction and get us started. Thank you all for coming. I saw a lot of names that I recognize in the attendee list, so it's good to see you all, or maybe I've just heard of you, but excited to be in the same virtual room as everyone. So we are a group of folks from Pennsylvania State Archives, which is me, and then the University of North Carolina, Chapel Hill. And so we want to talk a little bit about kind of what we are doing individually, but also how we have been collaborating to preserve and share institutional records in Pennsylvania and North Carolina, and maybe kind of start a conversation about how other states might think about collaborating across state lines in their own ways. I think with institutional records, it becomes very insular with each state where we have kind of our own specific history of mental institutions that are run by different states or kind of the access policies or the kind of records landscape that they look like in each state. What we have in Pennsylvania, as I've come to find, is vastly different from even our neighbors like Maryland, New York, other folks like that. But there are some places where we can work together, whether it's tools, whether it's collecting strategies or providing access or things like that, or even just tracking individuals who may have been institutionalized in multiple states, which we know is a fairly common practice over the centuries. So we want to kind of show you what we're doing, but also how we work together, and then see what you all think of that, what you make of that, and maybe encourage some of you to start thinking about how you might want to collaborate with other partners outside your own institution, outside your own state. So that's kind of where we're starting. And then just to kind of briefly introduce ourselves, I think the slides will be sent out and the recording will be out so you can look at this in more detail. I am Tyler Stump. I am an archivist at the State Archives. I'm the head of our record services section, which basically means we do the kind of acquisition or accessioning of archival records to the State Archives from government offices. And my co-presenters, who will all be speaking after me, Dr. Bobby Allen from the University of North Carolina, who's in their program in history and mental illness and the co-director of their community histories workshop, Indy Neihart, who is they're also in their program in history and mental illness, and Dr. Gary Gala, who is the co-director of the UNC program in history and mental illness, and also UNC psychiatry, philosophy, and mental health program. And I will let them all get into their particulars when we get to them. The way we broke it down today is, like I said, we'll talk about ourselves individually and what we're doing, and then kind of bring it all together at the end with some collaborative part. So first up is me. I'll talk about the Pennsylvania State Archives, and primarily I'm going to talk about our collecting process. So how do we identify, locate, prioritize for, appraise, and then prioritize for what we want to go to the State Archives for preservation. And then a little bit about how we're providing access and things of that nature. And then all my UNC colleagues will be talking about the work that they're doing at North Carolina. And then we'll bring it back together, talk about collaboration, answer any questions that anyone has that we haven't talked about already. So, Pennsylvania State Archives. And let me bring up my notes real quick. All right. Oh, and I didn't mention before, but thank you, Elizabeth, for inviting us to be here today and speaking. This dialogue series is really great, and I think it's been helpful for me to listen to a lot of these, just to know a lot of the things that I wonder about at the State Archives in Pennsylvania. Like, I'm not alone, I'm not the only one with some of these questions or things that I'm thinking about. So it's nice to know that there is a community out there, even if I don't know everyone specifically. So the Pennsylvania State Archives were located in the state capital, Harrisburg, Pennsylvania, in south central PA. We were founded in 1903 as the state's official repository for the records of our state government. And our mission is to collect, preserve, and make available for research the records that document Pennsylvania's history, with special priority for the records of state government. And that's what really brings me into this conversation, or this kind of the general, larger conversation about records of mental health and institutionalization. The majority of mental institutions in Pennsylvania were operated and regulated by the state and various state departments that had oversight or some sort of involvement with them. And so all the historical records from those institutions, from those offices, from those individual elected officials or other people in state government. The home for all of those records is the Pennsylvania State Archives. So we kind of centralize things all within the state archives here. I've been working here personally at the State Archives for about 10 years now. And in that time, we've developed what I think is a pretty successful records collection program with state hospital records, which has resulted just in the last 10 years with the acquisition of nearly 500 cubic feet of patient and administrative files from 28 different institutions around the state. And we've been able to provide public access to a large quantity of those records, and we'll get into what our access policy looks like later on. Our reference department right now is usually getting several requests every single week, if not more, for these records. So we're getting a large volume of requests. We've really hit the point. In fact, that's for every archivist. We collect knowing that we collect and preserve knowing that records will be important one day for research, and some days we don't always see when that one day comes. But with state hospital records, there is no waiting. People have been chomping at the bit to see these records, and they've really gotten a lot of use immediately as soon as we can make them available. So what we're doing here in Pennsylvania kind of breaks down into three things I wanted to cover. First, how we proactively locate and identify historical records that are stored at different state institutions, government offices, and a variety of other locations. Second, talk about our kind of robust appraisal process that helps us determine what records need to go to the archives now, kind of what is the priority, or how do we kind of safeguard or make sure records that are still active or still located at a state institution will be safe and come to the archives at some point in the future. And then that kind of leads us to the third part. So how do we actually physically acquire the records, locate them, and get hands on them and move them to the state archives and make them ready for research and use. So Pennsylvania's place, let's kind of going from here, Pennsylvania's place in the history of mental health care and institutionalization is both broad and deep. The state established its first state-operated hospitals in the 1850s, the first one here in Harrisburg, actually, but since then there have been many more around the state. In total, there are about 39 different, we usually call them either state hospitals, which are ones that are for people with mental illnesses, and state centers for people with intellectual disabilities. Although over the decades, there's a lot of kind of overlap and blurring of the lines of what specific institutions do. But anyways, we're looking at least 30 odd, if not more than that, different kinds of institutions. And they had hundreds of thousands of people who were institutionalized at them over a period of close to 180 years. So that is just a lot of records, a lot of history that we're working with. In the past, before I worked here and really kind of in the decades before my time here, the state archives really collected state hospital and institutional records fairly passively. We would wait for a hospital maybe to reach out to us and say, hey, we have old records, we want to send them to the archives. Sometimes if an institution was closing, we might get a call to come and root around and look for whatever records were on site. We have records retention schedules. Most state governments, I think, have something like that, which kind of gives some instructions on certain records. How long do you keep them? Which ones go to the archives or at least get reviewed by archives? But it doesn't really address a lot of the nuances in the historical records of state hospitals and other institutions that a lot of these records kind of predate any kind of records management or retention program. So what this really results in is that we have a lot of good materials, or we had been getting some good stuff, but there were also a lot of gaps in the collections. So now we've been trying to systematically go out to all the state hospitals, the ones that are still open, or the places that we know that older state hospital records from closed facilities are stored. And so we're trying to do two things, kind of record surveys, so going out and seeing what is here physically, what its condition is, the information types that we have, and then actual collecting trips, so actually physically taking possession of the records, bringing them back to the state archives. Sometimes those trips blend together. We go out just to survey or look around, and turns out there's records that are either in bad condition or they can move to the state archives immediately. And when we have an opportunity, we don't waste it at all. The one picture I have here on the screen is a hospital near Philadelphia. It turns out we were just going to look at records. They had a bunch of stuff in the basement of one of their buildings that could go to the archives right now. They didn't even really know it was there. It was kind of mixed in with a lot of other records and surplus equipment. I hadn't even brought boxes with me, but I wasn't gonna say I'll come back later. So we ended up just yanking the cabinets out of the drawers, sticking them in the back of my van, and taking them back to Harrisburg, where I was able to box up everything afterwards. But a lot of times when we're doing the field work like this, when we're seeing hospital records kind of in their places of origin, it's just you never know what you're going to get, what to expect. So we're kind of ready for anything, kind of just knowing at the end of the day what our goals are, what the records that are important to save are. So this is a map of where all the institutions around the state have been to give you a sense of just where they're physically located. Like I said, we have state hospitals for mental illness, state centers for intellectual disability, and then a variety of other types of institutions, reform and industrial schools, prisons that had mental health wings or different things of that nature, kind of institutionalization outside of the traditional institutional setting, I guess you could say. But just to show you kind of the physical footprint of where these institutions are. So as you can imagine, I travel around the state quite a bit. I've been to all the institutions that are still open, plus a variety of ones where records were stored and kind of in other locations where they could be accessed, but they were kind of sitting in storage more or less. So we've been doing a lot of field work with this over the last 10 years. Some of the issues that kind of come, or the challenges is probably a better way to put it, is one is just the sheer volume of records. So we have many institutions with many different people institutionalized at them, covering a large period of time. For every box of records that we brought into the state archives, there's got to be at least 10 to 15 boxes of records with stuff that have no historical value. So things that we're not really interested in for kind of the permanent historical value. But a lot of times they're all mixed together. So you've got to sift through them all. And so, sometimes the patient records, there's multiple copies of them. So we've got to figure out which is the one that we want to have in the state archives. There's routine administrative and financial records. There can be, sometimes just like totally other things like surplus equipment or things like that that are just mixed in together. It's all over the place. And then in addition to that, we get a lot of sets of records or information that overlaps. And so I'll talk about this a little bit later when I show some of the specific records, but you have things like admission files, case files, and master patient indexes, where they all document individual patients or individuals, but they have different amounts of information. Sometimes some record sets have holes or gaps in them where others are more complete, but some have more information than the others or different kinds of information. So just figuring out which ones are the ones that we need to prioritize because we don't have room or resources for everything. So what do we focus on? What's the priority? And how do you figure it out when you're at an institution and you just have one day to get through things and figure it out because you can only be on site for so much time? Like I said, each hospital has its own unique record situation, what they have, what they created in the first place, how they're stored, how they're labeled, their physical condition, some of the stuff that we have up here on the screen, records from Pennhurst State School and Hospital. They closed in the 80s, and a lot of their records were sent to another nearby institution outside of Philadelphia, about 15 miles away from them, for storage after their institution. The doors were closed. And by the time we got there, the staff, they knew these records were here, but they never looked at them. They just knew that these were the old Pennhurst records, more or less. These filing cabinets were locked with no keys in them, so just physical issues. We ended up having to get crowbars to pry them open to get through the records. They were stored up on one of the top floors of a building that had no electricity anymore. So we had no lights. Thankfully, it was a sunny day on this day, but no lights, no working elevator to get records out. There was mold growing in some areas in the building, so again, like high priority to get this stuff out of here. We ended up getting about 65 cubic feet of patient administrative files out of this building, but it was a big effort there, and that's one situation out of many. Another one of the issues or challenges that we have is just typically at hospitals, it's the medical records or sometimes the administrative staff who have kind of possession over these historical records, but there's a lot of turnover in these positions. It's not their job to be kind of archivists, and to provide preservation and research reference for a lot of these records, but they're the ones who have them right now, right? So we have to work together. A lot of times folks are sometimes hesitant. They don't even know that there is a state archives. We're a pretty small, a small agency within our state government, so they're not sure, should I be giving these to somebody else from central office from Harrisburg? There's a lot of turnover in the positions, so we work with one person, they've sent records to us, they retire, they get a new position, somebody else comes in, we have to kind of train them all over again. So we do a lot of outreach, a lot of training to just let them know that there is a home for these historical records. If you're not sure what to do with them, just give us a call or let's start a conversation. But it's an ongoing process. That's something that'll never end for us. Just a couple photos from some of the collecting and surveying trips that I've been on to show you kind of the range of how we find records in nature, in the wild, as I like to say. Sometimes you get them with no organization at all. You might just have a mound of boxes. We got to go through everything and sift through. Other times we know where the historical stuff is, but it might not be well organized. The one on the left is just, it looks like at some point they probably moved records from one storage location to another. Maybe they need to free up some filing cabinets. Things just got dumped in boxes. We were fairly certain with these. This probably happened a long time ago, and they might have just been swapped into newer boxes, but the original filing cabinets were probably, these are 19th century records. So they're not really problems that happen overnight, but when you have records that are kind of inactive, just sitting in storage, not being used for many, many decades, bad records practice just happens, and just kind of, it's what we encounter all the time. Other times, records are neat and organized and clean, and that makes our job a lot easier, but it's really just all over the place. So we'll have things that are, neat and organized on shelving, or are in kind of sometimes things, just if the records look old and neat, they like to put them in places where people can see them and they can get kept taken care of. But it's so all over the place. I don't think I've ever had the same record situation from one institution to the next. But that's part of the kind of the challenge, but also I think it's a good opportunity, because then no matter what the situation is, what the records are like when we get there, we've done this enough times that we know what to look for and what to do. We can kind of figure it out on the fly. Sometimes we have surprises. I think I mentioned a little bit before. We found that a lot of times that when one institution closes, a lot of times they'll move their records to the next nearest institution for storage. So it's kind of in the region, but maybe not necessarily, like at the specific institution. What I have here on the screen was at a state center that's up in Northwest Pennsylvania. And these are the original glass plate negatives from when patients were being admitted, and they had their photographs taken from about 1900 and 1920. And from what we understood, just at some point, they just put this filing cabinet down in the basement, and it was more or less forgotten about. And that's a good thing. Sometimes neglect is good, because what if somebody in the 1950s said, well, we don't need these negatives anymore. We've got the positives, we've got the prints, and just pitched them all, put them all in the garbage. So thankfully, these were still here. They were safe. They were in good condition. And I was able to kind of get all of this moved. It was about 20,000 glass plate negatives. So again, large volume of stuff, but we have a lot of good surprises too. So like I said, you never know what you're going to get, but getting on site, doing our surveys, talking with record staff about what they have, or at least where records might be stored, and then we go and look at things, that has made a world of difference than just having a retention schedule that tells people what they should, call us about or something. Getting out there and getting hands-on records has really made a big difference for us. A couple other things that have been helpful about the work that we've done and kind of actively going after these records. We have collected a large amount of records, like I mentioned, so we've had a good feedback loop. We see from our reference department what is the public asking for, what records are they using, what kind of information helps answer their questions, and that tells me what I need to go after, or start paying more close attention to. Also, what kinds of records are people asking for and we don't have, because that tells me, what some of the gaps in our collections are and what we need to focus on in the future. Also, just looking at other scholarship in other states, seeing what other folks are doing, what kind of records they're using, in what ways they're using records. That has paid off a lot. We've been doing this long enough. We have a lot of turnover in the institutional staff, but we have a good working relationship with them. I get a lot more calls now than I used to, with people like, I heard you're the person to call. I have old stuff in a basement. I don't know what to do with it. Sometimes we even find staff who have retired from an institution. It turns out 20 years ago, they took some records or things home with them, and they're stored at their home, or things like that, which just happens. Records walk off when you have institutions with thousands of staff over many decades. And so that's all great. We're just glad to bring things back home and keep it all together in the archives. Another advantage that we have being a state archives is that we have a couple of different kind of tools at our disposal to help encourage people to send things to the state archives. I can appeal to people's sense of retention policy and compliance with policy and regulation. if they're that's more what they're interested in, because not everybody's interested in kind of preserving the history or history for history's sake when you talk with state staff. Other times it's more just a pragmatic thing. If you send the records to archives, you can free up space in your office and you don't have to dig through them or preserve them anymore when somebody asks you for the records. So we're freeing up your staff time and your resources. Other times just appealing to their sense of history and just, we want to preserve the history of your institution, the place you work, because a lot of the staff have very, strong feelings about the history of where they work, and that sort of thing. So depending, once we talk with people, get a sense of what their concerns are, what their priorities are, we can figure out the best way of making them feel good about sending records to the state archives. So once we have records that have come to the state archives, once we've gone out, we've located things, we figure out what we want to move to the state archives, and they go through our, we've accessioned them, we've processed them, they're available for research. Currently, our access policy is based on our state administrative code, which incorporates, we have state mental health code, and other things kind of that nature that are in their HIPAA is kind of guided by that. But currently, non-patient or records that don't identify individuals, they're always open for public research or reference. Records that do have individuals or the names of patients in them, they are closed until the record date is 75 years, so when the record itself is 75 years old, or if a requester, they have an individual that they're seeking and they know that they've been deceased for 50 years or more. So that's not something that might necessarily work in other states, depending on kind of your legal framework of what you have, but that's within Pennsylvania, that's kind of the legal minimum of what we were able to do once we worked with our counsel to determine that. In the past, it was different where we would redact just the mental health information in records, and that was a lot more complicated. So I think having this timed release has been a good change for us. That was a change just a few years ago. The legislature changed our administrative code to put that 75-year rule in place. We also have some waivers for scholarly research if people they would have a plan for how they're going to protect the information of individuals who are named in records, but then they can kind of go through and look at a larger set of records that might even contain restricted stuff. And we determine those on a case-by-case basis with the project. Most of our reference has to be done by the archivist. So it's not really a self-serve thing where you would come in, request patient records and look through them on your own. Just because there's so much restricted material still, you only have a ledger book from a hospital, and it might cover people admitted from 1900 to 1975. So yeah, they can't see the second half of that ledger. So typically our reference staff will receive the request, will review the case or what they're asking for to see what records can be made available. And then our staff will go through and copy that information or copy those pages and make that available to the research. It's a pretty laborious process. A lot of times our requesters have really limited information about what they know about the person they're seeking. Most of our patrons are genealogists. They might just have a name. They just have a name and they said, I heard that they were institutionalized at some point. We don't know when, we don't necessarily know where, we don't have a patient number or anything like that. So locating them can be a real challenge when we have really limited information. And we found that having multiple sets of records, even some that overlap, but maybe we'll find them first in an admission book, and then we'll get a patient number, and that will help us locate them in other sets of records. I'm going to kind of gloss over this a little bit because I know my UNC colleagues will talk about it, and a lot of us on the call, I'm sure, are familiar with the kind of general hospital type records. But the three main categories of records that we get, the first one obviously is individual or patient records. Your admission and discharge ledgers, your patient indexes, case files, and kind of the records of specific individuals and their personal lives. And then after that, the other things that I think are really things to consider for other folks are the administrative and operational records of institutions. So they're ones that might not mention specific individuals, but they kind of round out the experience or maybe kind of the bigger picture of what life at an institution at a certain point was. A lot of times people have questions. They say, okay, I found the case file, but why were they sent here? Like, what was the reason they were sent? And that might not be in their patient file. I mean, looking at what was the admission policy or what was the kind of legal framework around admission in 1915 when we know this person was admitted. Those are important questions, and you might not find them in one record set, but you might find them somewhere else. So even if we have an annual report that doesn't mention an ancestor by name, it can be useful to share that with the patron or whoever's doing research to give them the bigger picture of things. So all things to consider. So an example of one of our admission and discharge records, that's probably the thing that we get the most consistently. I think there's always a general sense of anybody, no matter what their understanding of kind of archives or history is. Admission and discharge records seem important to anybody as an old leather volume or something. So usually not a lot of questions with that. And so we've actually digitized, we used a microfilm, but now we've been digitizing a lot of those just because we can do the searches with them a lot easier. They're usually pretty stable sets of records that are easy to reformat. Next set is we call them usually patient indexes or patient card files, and so those are kind of they would have them in the medical records office for quick information about all the patients. And so we usually get them from a lot of hospitals. Here's an example of what one looks like from an institution near Pittsburgh. So they have a little bit more information than what you might see in an admission and discharge file. Another thing, here's another example of one. A lot of times they will give us kind of clues to other kind of records we might want to look for. This one notes that this person was previously institutionalized at another private institution called St. Francis Hospital in Pittsburgh, and also that they were afterwards, it says in the top corner, that they were transferred to another facility. So now we have the records of three different facilities or institutions that one individual was institutionalized at. So sometimes records kind of, you pull on a thread and you kind of see where you're going. But again, for why it's so important for us to centralize all the records from around the state instead of keeping them at individual institutions. Keeping them all in one place really helps us for the researchers so they don't have to bounce around between different institutions with different admission, procedures and things like that, or like reference access procedures rather. Here's another one that mentions that the father of this patient was also institutionalized at the same place. So again, so seeing familiar relationships and maybe additional things that people might want to research or kind of paths that they might not have expected come up a lot. So again, really rich source of information. A little bit harder to digitize and reformat than an admission book, but again, kind of overlapping but additional information. And then the third main piece of patient records that we have are the case files. Typically, it's going to be a folder or series of folders. That's like the almost day-to-day kind of experiences or really gross detail or fine detail about an individual. This one's from an institution in Northwestern PA. This one had a photograph. Sometimes they do have photographs, other times they don't. Here's another one here where they actually they called it a pedigree chart, but it was kind of genealogical information about this individual who was institutionalized from about 1915 to 1960. But it lists multiple generations of his family going back. They were looking for history of mental illness, but there's also additional information about where they lived, their dates of birth and death, and things like that, that the patron who was looking for this didn't have this information. So a lot of additional stuff that's going to be in a case file. But we also find that case files are usually the most fragmented source of records where the hospital may have kept some and thrown others out over the decades, especially with 19th century records. Sometimes we found that maybe in the 50s or 60s, they microfilmed a lot of these records. Sometimes they kept the original, sometimes they didn't. Sometimes the microfilm is in various states of condition. So it's really all over the place. But when case files are available, we really try and prioritize getting those to the archives as well. Here's another one from Pennhurst State School and Hospital. This one had a photograph on the front too. That's something we like to see. You can see this one was taped up and it's torn a little bit. So they're usually in rougher shape, but again, the information in them is really great. I know Bobby and the other UNC folks are going to talk about how they are kind of extracting information from different kinds of record sets. So again, how the information is laid out on the page is something I've been more kind of thinking more about when I appraise records with how can we gather the information from the records in an efficient way or prioritizing records that are information rich, but also that can work with some of the tools or ways of extracting information. And these are more pages from that case file. So again, a much finer level of detail about an individual than you would see in some of the other types of patient records. I'll try and kind of wrap up pretty quickly. Some of the other non-patient records, I have a bunch of examples here, but superintendent's files, employee records, photographs, reports, financial and audit information, maps and blueprints, all of these things we have used them or researchers have used them to kind of gain a better understanding of the lived experience at an institution. And they really do make a difference, even if they don't mention, an individual's name or anything like that. But genealogists and researchers of all stripes have used these to great effect. So when we're appraising, we look at these kinds of records just as closely as we do the patient records. They wrote just for the historical value that it's unmatched in a lot of ways. Some of my favorite examples of ones that I've collected, including some of these hand-colored photo slides and negatives from things from some of the hospitals. But there's really a lot of variety, of just what individual hospitals were creating or what they've saved over the years. So that's been really nice for us. And so I will stop my portion here with just my contact here and our State Archives website. If anyone listening is interested in patient records from a specific Pennsylvania institution, we'd love to help you out. Please get in touch. Or if anyone else is just interested in kind of the criteria or the certain types of records that we've been focusing on when we're collecting records, I'd be happy to talk shop with anybody if you're an archivist from another state as well. So, all right, I will wrap there and pass things along.
Thank you so much. Yeah, I think everyone can see why those of us who are working things at the North Carolina end we're just gobsmacked by the first of all the amount of material that you have, its diversity, but we're so impressed with the process and with your determination that these are records that need to be identified, they need to be preserved, they need to be curated, they need to be shared. So in anticipation of making something of an announcement of our interinstitutional collaboration, I wanted to go back to the history of our connection at UNC with the preservation of mental health care records, excuse me, and sort of the points along in that process, where we are now and where we're hoping to be over the course of the next year or so. Helping me kind of take this journey is Indy Neihart, who is driving the slides for this right now. But Indy, how long have you been working on this with me?
Oh gosh, probably about 5 years. When I was in grad school for library and information science, I did a research fellowship working with some of these records back when it was more of a community history project, and just have kind of stayed attached to it as the project archivist and technologist since then. Yeah, now we're in this exciting phase of doing a lot of work with psychiatrists and research-focused work, but also collaborating with the Pennsylvania State Archives. So I'm really excited to be here.
My background is actually in American Studies. I'm a historian, and my work has been around cultural history for the most part, but I've also done work that's specifically about the history and the social history of North Carolina. And that's sort of how I got involved in this. We were asked back in 2017 to work with the Dix Park Conservancy. Dorothea Dix Hospital is the oldest and it was the largest public insane asylum in North Carolina. It opened in 1856 and closed in 2012. And they were in the process of doing a master plan for converting the site, which is 308 acres, into what folks in Raleigh call a destination park. But they needed someone to do a kind of historical due diligence on the material history of the hospital. And so I agreed to do that. And that's what put me in the search room of the State Archives in North Carolina. And I discovered that fortuitously, the state open records statutes had recently been changed, and they had been opened to allow public access to state-created records that were at least 100 years old. And I know that Pennsylvania worked hard to get their access down to 75 years. But what it meant is that anything that the State Archives had from Dorothea Dix Hospital from 1856 to a day 100 years ago was available. So I opened a similar red leather volume to those that Tyler has seen tens of thousands of, and discovered that it was a 19th century spreadsheet. Basically, on the left-hand side was there we go. The left-hand side was the basic information that Tyler also had on the form that he showed us. name and marital status, education, no, sorry, not education, occupation, a column called supposed cause, which I'll come back to in just a little bit. But I asked the staff archivist there what their plans were insofar as digitizing these records, because I had some background in digital humanities. And they said that they didn't have any immediate plans to do that. And I asked them if digital images could be made of those records. And he said, yes. And I said, then I plan to make digital images of all of them that are available. And it was a process just digitizing them individually with the 35 millimeter digital camera. That wasn't the most time-consuming part of the process. The most time-consuming part of the process was transcribing those records and getting them translated from messy humanities records to structured data. But I did want to ask folks, if these are if the admission records that I'm showing you look familiar to you, because as Tyler said, what we're finding is a kind of formal continuity across record sets that seem to be collecting the same kind of information and in the same format as is done in other places. So if things like this looks familiar to you, if you could just jot that down in the chat so that we can incorporate it in the record here, I would appreciate it. So that's the left-hand side of the admissions ledger. The right-hand side it continues with other information about the individual, but very importantly, the information is actually carried forward, excuse me, for each patient to the time of their discharge or their death or their transfer. And you can see here that they've also computed the length of stay, the residence in the hospital. But this also means that these records were created on the date that the patient died, not the date that the patient was admitted to the hospital. And so we are restricted in the records that we can use if the disposition date, the discharge or death, falls within the 100-year period. And that's why you see the little pink slip there covering over records that fall within the 100-year sequester period. Okay. So the other category of records that we found, and Tyler, when we finish, I'd be interested if you have an exact correlative in records that you have. I know that you're capturing a lot of the same information, but I didn't know if this was also a common form that was used. But this has these over 100 data fields, if you like, for in each page, each record is a patient. And so we can coordinate these patient records with the admissions ledger as well. This is a process that started in 1887, and we have, I think, about 3,000 of these records, but they are very detailed, and particularly for going back and looking at the history of psychiatric diagnoses and symptoms. These are incredibly important records. Next. We also have a limited set of medical staff interviews. So the general casebook entries would have been made shortly after the patient was admitted. Within a month or so, for some of the patients, not all of them, we have medical staff interviews with the patients and verbatim transcripts of those interviews. And you can see the first page of a 3-page interview here. Unfortunately, I mean, the good news is that we have some of these. The bad news is that we only have them for about 2.5 years, from 1916 to 1918. But this does cover the period of World War I and the influenza epidemic. And a very important period in psychiatric diagnosis, particularly around schizophrenia or what was called dementia praecox at the time. Okay. We also discovered at a later point in the process that well, first of all, we knew that the commitment process did not occur at the asylum itself. That the patient who was admitted to the hospital had already been declared insane, and that this process was one that occurred at a county level and was much more a legal process than it was a medical process. But I couldn't find these records for North Carolina in the state archive until I stumbled upon a call number for records that all ended in the letter X. And I asked the archivist there what that meant. He said, "Oh, those are microfilmed records." And to make a long story short, in 1899, the state of North Carolina changed its lunacy statutes, as they were called, to mandate the same commitment process for each of the state's 100 counties. And they specified the form in which this would be done. And this is what you're looking at. It is called an inquisition of lunacy. So it contains the name of the individual, the name of the person who's filed an affidavit with the clerk of superior court attesting that this person was insane. The three-member committee, usually chaired by a local GP, certainly not a psychiatrist, and then the clerk's determination as to whether or not the individual was insane, and if that person was insane, their commitment to the appropriate institution. And by appropriate institution, it was meant racially appropriate institution. So this meant that if you were white, you were committed to Dorothea Dix Hospital in Raleigh, or after 1883. If you lived in the western part of the state, you could have been admitted to Broughton Hospital. But if you were Black, regardless of where you lived in the state, you would have been committed to Cherry Hospital in the eastern part of the state in Goldsboro, North Carolina. So I assumed that these were microfilms of records, the paper version of which were also kept by the state archives, only to discover that, I think as Tyler kind of referenced there, when these records were microfilmed, it was an excuse to destroy the paper records. And so the one copy of the microfilm was all that remained of the record for commitment for every person in North Carolina declared insane between 1899 and 1966. And I asked for digital copies of this record, and they asked me which ones, and I said all of them. So I had 250 reels of 35 millimeter microfilm, with each reel having about 300 record images digitized. It took them about 4 months to do this, but now we have digital copies of these records arranged by county and date. And Nate is working on the part of the process I want him to talk about now, which is transcription, because transcription emerges as being the bottleneck in the process, but also one of the most exciting areas now for us to continue work with.
Yeah. So when I came on board, there were the admission ledgers and the general casebooks from Dix had been transcribed, and that had been done using student employees at the university. And so one of the things that I started working on, because we had a psychiatric resident who was trying to look at incidents of dementia praecox between white patients and African American patients. And so as part of that process, we gained access to records from the Cherry Asylum. And so I started using Transcribus, which I would imagine a number of you are familiar with, to try to train some machine learning models to automate some of that transcription process, because the admission ledgers from Dorothea Dix Hospital took, I want to say, about 2 years to transcribe, and we needed to compress that so that a psychiatric resident could work on that research. And so this was a bit of a laborious process, but it cut the transcription process about in half in terms of kind of labor and time. And since then, we've also been exploring the use of Gemini and Claude AI models to kind of improve that kind of labor cost of time. they're not as good at handwritten recognition as Transcribus is, especially since you can train Transcribus on the handwriting. But they are a bit more efficient. And so that's kind of where we're at right now, especially with the Pennsylvania records, is learning how to apply those models to kind of get highly accurate transcription of these records for research purposes, but also, as we'll talk later, for reference services. And then a lot of you are also probably familiar with OpenRefine. And so obviously what we end up with, especially when you're using models to, or even students to transcribe these documents, is very messy data. And you've preserved the mess because you want to represent the document accurately. And so to clean that up, we typically ended up using OpenRefine to kind of give us a sense of what was in every column, and then use some of its built-in tools to kind of like cluster and re-aggregate the data in a normalized field. And yeah, so then as we're kind of working with that data, something that we've started using more recently, and I'll let Bobby chime in here, is Notebook LM. And so kind of before this, we would have a conversation with researchers, or Bobby and I would be having a conversation, and then we would have this question that we wanted to answer with the data, and I would have to write our code, or it would take a moment. And this tool, as Bobby can attest, is kind of source grounded, and we can give it not only put our data in it, and it's not utilized to train models according to the terms and conditions, but you can also add other sources that you want it to use, and it's less prone to hallucination because it's not kind of going outside of the box that you've given it, which isn't to say it's immune from it, but yeah, I'll let Bobby talk a little bit more about that.
Yeah, I mean, there's a lot to be said here. The bottom line for me is that this is a window onto the future of how we will use these documents and what we use them for, and it, I think, is the ethical and responsible application of AI to the kinds of records that you are all familiar with. And one of the advantages that it will have, we hope, for Tyler and his staff is that Notebook LM really doesn't care where the source document came from. So it can track something that you're looking for, a patient name, across any number of individual institutional records, rather than someone having to look through each individual institutional records separately. So that's what's going on the left-hand side. Those are the sources, and they're only using sources that you have added to the notebook, and so you've vetted them. The middle is where basically you're interrogating the source material. You're asking questions of it. And Notebook will actually suggest questions that you might want to ask based upon the patterns that it's seen already in the data. And on the right-hand side, you see the different output modalities that are possible with Notebook LI. And I want to focus on one of them, which I gave you a taste of over the last week, if you've had a chance to listen, is the facility with which Notebook LM can create a podcast. And I want to use this also as an opportunity of introducing Dr. Gary Gala. And it is through Gary's intervention, you might say, that ND and I are happily working in the Department of Psychiatry, and it's as our new home. The program in history and mental illness was launched a year ago, January. So I want to introduce Gary, but in particular, Gary, I'd like for you to describe what the clinical liaison case conferences are and how they're connected with this process of historical research.
Thanks, Bobby. Glad to be here, everyone. Thank you for having us. Yeah, I mean, when Bobby and I started talking about getting together and putting together a program on history and mental illness in the Department of Psychiatry, one of the things that we quickly thought was, well, we want to have this be relevant to current practice. And we came up with the little tagline, archive to bedside, to describe what we were on about. And so along the way, the idea was to Bobby join our consult liaison case conference, which is a 3 times a month conference we have at UNC, looking at current cases involving medically ill patients with psychiatric diagnoses and psychiatric issues. And Bobby's been attending that now for a number of months. And I think it's been very beneficial to hear some of the very current issues in contemporary psychiatry, at least this part of contemporary psychiatry, and how that might be linked to historical views that were taken. And so our archive to bedside idea, I think, got supercharged with ND and Notebook LM when we were able to bring aspects of the conference itself, literature. Bobby has a current or recent paper from Nature there, as well as the historical archive, and bring them together rapidly. They're currently thinking about podcasts here into a podcast that would discuss both the current issues, how they relate to historical records, and how they relate to the current literature. So we've been very excited about this opportunity, and I think we're excited to have both our trainees, our residents, and some of our faculty get involved with this kind of a project. I'll just say one other thing, and then I'll stop. I think for me, I'm not a historian, I'm just a simple psychiatrist. For me, the fun of this is to see how historical records really do inform current practice, and how current practice can shed some illumination on the records. And I'll stop there.
Thank you, Gary. Yeah, I think we're kind of running short on time. Nate, sorry, Indy, take us to the kind of summary of this is kind of the 3 strands of work and the 3 time frames. I won't bother to go through and read all of these for you, but you can see that the point that we're at is that we have identified, accumulated, digitized, and transcribed a very large set of records having to do with the history of mental illness in North Carolina. The difference that we have with Pennsylvania is that we have only 4 state-supported institutions historically, instead of many that are in Pennsylvania. And our records, because of the state law, only goes through 100 years, and we have the 100-year sequester period. So one of the things that we're really excited about as we look ahead, and we look ahead to a more formalized relationship that we've developed casually over the years, is the opportunity to bring the extraordinary richness of the Pennsylvania records, both in terms of type of record and the period of time which is covered, and bring those together with the records that we have. And in particular, the opportunity that we have in North Carolina of looking at race segregated institutions over a long period of time. And to add that with the records from Pennsylvania, and I think AI and Notebook LM in particular may be a very good nodal point for connecting the 2 institutions and their records. So one of the first things that we talked about kind of doing and collaborating on that Tyler mentioned was how can we assist the staff in the Pennsylvania State Archives who are receiving these requests from mainly family members, but researchers and others, where they have a very little bit of information to go on, but are trying to find the institutional history, if you like, of a particular person across record sets. And I think that we can bring to bear some tools and with their records that might make this possible, but also may be generative to other archival situations in other states as well. That's one of the projects that we're working on. Another is Tyler has been downloading and uploading and sending to ND the Pennsylvania records so that we can have a repository for them as well. And we've just started. The nice thing about AI and Notebook LM is it doesn't take you 2 days to run a query. It takes you 2 minutes to run a query. So we can, if you give us 15 minutes, we can look more deeply into the record sets that we have. So I think that's pretty much it, indeed. But we have any other slides there that I'm missing out on? That's just a kind of summary. We'll go past that.
And our contact information is also going to be at the very end of this as well. So we can you'll have a chance to see this again later. Yep. So now we're well, Bobby, do you want to?
Yeah, Tyler, I also, if you would say a few words about how this collaboration will work, if you like, at your end, and where you see the benefits in general of this kind of interinstitutional collaboration.
Sure. I had to look back in emails before this, but Bobby and I first got in touch. I had seen that he had done a presentation. I think it was for maybe the North Carolina State Archivists Association or something like that, something within North Carolina. But I think that was 7, 8 years ago. But just kind of talking about where you were at that point. And I thought it was interesting. Some of the records, I recognized the admission books. Like, I have admission books like that, and I'm not really sure kind of what all to do with those or providing access. So I emailed you and I just said, hey, I saw this presentation. You want to chat sometime? Maybe we can talk about the records we have and how we use them. And that has kind of just blossomed over the years. And so we keep up. We talk about what each other is doing. Sometimes I give Bobby's advice on when I've been out to a hospital and I've got a bunch of different kinds of records. And what are the potential research uses of some of them that maybe we haven't encountered before? Or are you seeing similar kinds of things? Are the ways that Bobby and his different students and collaborators over the years have traced individual patients through many different sets of records, not just admission book records, but also many other disparate sources. So that's kind of informed my practice in different ways. And that's been just very helpful as kind of just like a sounding board maybe. And I'm sure, Bobby, you could talk about ways that maybe different things that you've learned from the Pennsylvania side of things have kind of either affirmed what you're doing or maybe made you think about things in a different light. But just from my perspective as someone who works in state archives on the collecting side or kind of the records custodian in a lot of ways, that has been really critical for me to get that feedback. It kind of supplements what I'm hearing from or seeing from our reference department kind of side of things. But it's giving me another perspective on that. A little more practically right now with some of the collaborative work that we're doing with where we're sharing records with the UNC folks, and then they're kind of running them through some of these tools. That's not my decision to make alone. I don't own these records, and I'm, kind of in the middle of the chain in the state archives here in PA. But our archivist, Dave Schaaf, has been, supportive of seeing where this is going to go. I'll admit we're all kind of very tentative about AI tools and things. I think that's the field in general. I mean, these are tools that are in their infancy, and that could be just a talk in itself, just AI tools generally with records, but this is a really it's not a mature field yet or a series of tools. However, I mean, when I see our reference archivist and we get a records request and somebody just says, all I have is a name and I think they were institutional and I'd like to know, and our reference folks, I mean, sometimes they will look through 60 years of admission files to see if we can find a person. And sometimes they do find them. I mean, sometimes they're in there, but they're so buried. And that's even if the record is digitized, that doesn't make a difference. When we had that limited information tools like this, where, I can give Bobby and Indy, I can give you a scan of some admission files from Harrisburg State Hospital, and you can spit out a spreadsheet that maybe isn't 100% accurate, but it's very close. You can spit that out in 10 minutes, and that, just so I think the potential for research and not that this is replacing archivists and the work they do for us, it's just we have limited staff. That's not going to change anytime soon. And so giving them some tools or some tools that maybe are, and this is something I think we're also interested pragmatically. If it works for state hospital records, it could work for other things. It could work for military records. It could work for land records, for prison records, for things like that. But so I think we have the records, and North Carolina has some of the tools or some of the kind of different thought processes that we just don't have kind of from our kind of state government perspective or our kind of position. So that kind of very, very pragmatically was what has, pushed or kind of kept us involved with this, or at least we're willing to see where it goes. Because I think even if we just get like a fairly accurate spreadsheet that lists all the patients out, and we can at least use that to say, okay, you should start looking here when we're trying to locate a patient request. We've already, saved how many countless hours. We get, like I said, sometimes a dozen requests a week. So if you multiply a 5-hour search for records over 12 each week over the course of a year, it's a lot of work. So that's something I think is, kind of pragmatically, like I said, that is why, as an institution, we're interested in collaborating and kind of exploring things like this. But I think other or something else to consider is that we know a lot of institutions, or we know individuals traveled between institutions, whether that's within one state like Pennsylvania, but it also goes across state lines. We see references in case files and admission records to previous or subsequent institutionalizations very frequently. In fact, we got one recently where somebody was institutionalized in Texas. Actually, Elizabeth, I'll have to send you a scan of that one. But that's not, uncommon. And even if an individual, and the administrators and physicians and supervisors, they communicate with people from other states. They talk with their kind of their peers. It is a big web and a network. And so I think thinking right now as kind of records custodians, as historians, as other researchers, it can't be insular anymore if we're really going to tell the researchers or the people who want to know this stuff. I don't think one single document really gets to the answer that they really need or are looking for. Sometimes I think collaboration is the only way that we're going to get like this much broader and more kind of comprehensive answer to a lot of these things. So that's my 2 cents for that.
Tyler, final point, and then we can open up things for discussion. Addressing the question of AI, I think we are kind of ideally placed to explore AI in relation to these records and for these purposes. And because we sit at the intersection of archiving on the one hand and psychiatry on the other. And so the folks that we've worked with who've come out of our School of Information and Library Science, and they've made up most of the teams that we've had working on this for a number of years, part of their training is to look at ethical dimensions of archiving practice. And in fact, Sarah Alman, who was the person who I worked with in developing the transcription tool, she developed the transcription tool for the Dix records. Her thesis was on kind of the ethics of archiving. Then on the other hand, the folks that our colleagues in the Department of Psychiatry obviously deal with these ethical issues on a daily basis. Gary, I'd be interested in what you think the general reaction to your colleagues is of a future that heavily involves AI. Are they afraid of it? Are they eager, or somewhere in between?
I'll go with somewhere in between right now. If it makes it easier to write notes, and cuts down on the pajama time. I think they're all for it. I think there are a lot of concerns about making sure the information that you're getting is accurate if you're going to use information. And one of the things I like about the LM Notebook, if I've understood it, is it only can use what you give it. So you can vet the sources before it even begins its work. So I think it's a mixed bag right now.
Okay. All right. I think we'll stop there and turn things back over to Elizabeth.
Fantastic. Thanks, y'all. That was really fascinating. We had a lot of questions come up in the chat, but um, Tyler and Indy were pretty diligent about answering them. So if I just wanted to open it up, if you wanted to expand upon any of the answers to the questions, or if anyone who asked a question wanted a little bit more, to go ahead and raise your hand. Otherwise, we're open to new questions.
Can we take
Yeah,
down
well,
the
I think
slides?
it looks like Jamie had a comment about the environmental impact of AI, and yeah, like we definitely haven't mentioned that or addressed that, and I think that's kind of like a long-standing even before these major AI tools. Like most people I know who have been doing PhDs in public health and are running large, working with large data sets around public health or around psychiatry, have had to grapple with that for the past, 10, 15 years, because of, yeah, the utilization of those computing resources. And yeah, it's definitely a real question. Also, this last, there is a QR code, and I will put in the chat a contact link if y'all want to get in touch. But otherwise, we can just go back to new questions.
If you have a question, use the raise hand function and I'll call on you to unmute. Tyler, I had a question, which was, how do you find the records? Like, how do you know where they are? So obviously for the active hospitals, you might have an existing relationship, but for any of the closed hospitals where the records were relocated elsewhere, maybe 30 years ago or 50 years ago, how do you figure that out?
Um, the answer is it depends, but that's probably the archivist's answer to every question.
Mhm.
We usually we look for some kind of a paper trail out. Typically, institutions have sent it to the next closest institution and stored it there. However, sometimes we find, and then that place closes, and then they go somewhere else, and sometimes they go 3 or 4 places. Um, Last summer, I was going to, like I mentioned, there was one place, the place that I had all the records in the back of my van. When we got there, we were looking for one set of records. Actually, Bobby, you had a colleague who clued me into he had thought, or he had heard that there were a bunch of microfilmed records from like the Eastern State School and Hospital that he had looked at with the medical record staff at this place in Norristown. So I called them asking for one record, and they said, "We're not really sure if we have that or not. To be honest, there's just a lot of stuff in the basement. Why don't you just come here and look?" And going through, and I realized there aren't records from just 1 or 2. There are records from 7 other closed, I think it was 7 or 8 other closed institutions, all in the basement of this building. And so once we realized exactly what we were looking at, and a lot of record staff, and no shade on them because they have, I mean, they are keeping an operating, an active facility open. Monitoring old inactive records in their basement is not their job. So a lot of times they just sit on it and they don't really know what they have. So a lot of times just asking around, I just say, do you have any records that are in stores that you're not sure what there are? I'm looking particularly if anything is labeled, and then I might mention the names of hospitals or institutions. And we at least start from there. Sometimes we'll find a paper trail, or somebody might remember and they'll ask someone else. Sometimes we find out too late, quite honestly, and we find that, oh, like certain records may have been destroyed at a certain point. Maybe it was a misunderstanding of a record's schedule or something like that, or that records don't really match with something on records retention schedule, so they weren't sure if they were supposed to keep a record that we probably would have liked to have at the archive. So sometimes we do find out too late, which is unfortunate, but it's a lot of phone calls, a lot of cold calls, and a lot of just saying, can I come out to an institution and just can you just bring me out with a facilities guy and just any building where old stuff is stored? I don't even say records necessarily, just old stuff, because sometimes it's mixed in with old surplus equipment and things like that. Um, I just root around a lot and get pretty dirty, but that has seemed to be the most effective way just to be as broad and comprehensive as possible and not leave any stones unturned.
Well, I'll give it another minute, but if there are not any other questions, we can wrap up. Well, thank y'all so much. This was such a fascinating presentation, and I learned so much. I felt so many points of familiarity with my experiences in Texas and everything else I've heard talking to folks. So I really appreciate the work that y'all are doing and for sharing it with us.
Thank you,
Absolutely.
Elizabeth, the feeling is mutual. We really appreciate you and the Hogg Foundation creating a forum where we can talk about issues, because I think we share an awful lot of the same issues, and we didn't even get time to talk about access policies across states that could occupy us for the better part of four or five webinars. But this is
Absolutely.
really important to be able at least to identify what's your colleague group, what's your cohort, where are they, what are they facing?
Absolutely. All right, everyone, have a wonderful day and thank you for coming.
Thank you.
Thanks, everyone.